Hello, welcome to exercise application video number 13, I believe. I just got done at the gym. Also, I realize it looks like I never work out. You probably can't see it. My gym is down in there. And I record these in the car afterwards. And sometimes I'm not driving. So I do actually work out. I don't just go sit in my car to make these videos. But today was a lighter intensity day because I am having a pretty active flare-up. So it was chest, shoulders, and triceps. So I did some bench press, I did some incline dumbbell bench press, I did some shoulder lateral raises, supersetted with front raises, pec deck. I did some tricep extensions, some tricep push downs on the machine, all the things, but low weight. But what we've been talking about in class is the cardiovascular system. And this is super, super important for exercise because if our heart isn't functioning right, we will die. It is absolutely essential. But the heart has a lot to do with electricity as well. We talked about with the muscular system when we were talking about muscular contraction, how it was triggered by electricity, and we got into this with the nervous system, how we actually propagate a cell, or how we propagate our muscles into moving with the electricity and the moving of the ions. It's a similar deal for our heart. So the difference here is we have skeletal muscle and cardiac muscle. Some of the big differences here, cardiac muscle has these things called intercalated discs. And what this allows is for once depolarization comes into the cell, it allows it to go in a rhythmic order, because our heart, right, like our muscles, we can have them contract kind of at not abnormal, but at a not constant rate. We can't have that with our heart. That's called an arrhythmia. That's called you may be having a heart attack. We don't want that. So our heart has to contract in a very rhythmic, a very set way. And so by having those intercalated discs, it allows depolarization to travel through in such a way that we are able to get appropriate contractions. What we see actually is our atria contract from the top down as they push blood into the ventricles, which is called systole, and our ventricles contract from the bottom up, which is called systole as well. But when the blood is pumping from the ventricles up into either the pulmonary artery or the aorta, our atrium is in diastole, so it's resting. And that's actually where we get our blood pressure readings. When you're looking at the top number, that's your systole, so as things are actually contracting, and then diastole is as things are filling. So our heart is dependent upon these intercalated discs and the particular structure because it's what allows our heart to beat in rhythmic contraction. Whereas our skeletal muscles, we can say, okay, I want to flex my gastroc muscle. That signal goes through, flex. My heart, I can't do that. Also, a big difference with my heart, although it's under the control, it's innervated by the sympathetic and the parasympathetic nervous system, which are part of the autonomic nervous system, which you are not consciously regulating, but there are things you can do to intentionally increase activity of certain things. So for example, if I wanted to increase my heart rate, I could, but it's not intentional in the sense that I can sit here. I mean, I could because I have anxiety, but a normal person couldn't sit here and say, okay, heart rate increase. It is involuntary. So when I say that sympathetic, if I exercised, if I were to get really anxious or afraid, that would increase my sympathetic activity, which thus is going to activate my excitatory nerve, and then we'll get into that in another video, but it's going to actually increase the activity of my sinoatrial node. So